the Lean Healthcare Initiative is an effort of some institutes to try to work together and develop some kind of new knowledge so we can help to shorten the lead time to develop the capability that organizations need to make the Lean transformation. And basically we realize that if it would take like 10 years to develop someone, it would take maybe 1,000 years to change the industry, and we would like to shorten the lead time of doing that.
We choose this name for the moment, actually, because it's related what happens in Toyota. Toyota has this figure that has the transformational leadership. It doesn't mean that they have any functional leadership. It's just the person that leads the transformation, that coaches the people to move from the one stage to another stage to deliver not only the service, but also the organization to the next step. So we want to create this figure because we think that this figure is the key to make this transformation.
One of the first things we knew we had to do was go visit each other and watch each other work. And that meant leading teams, training, doing the work, doing all of that. And so that was part of it, and so we went to each other's countries and did the work. And we started to collect the information and capture it in a structured way using the Lean Transformation Framework House. And as we captured these cases, we started to look for criteria that worked across and measured how were we working and started to see commonalities across the institutes and across the way we worked. That's the gist of it. There was a little more detail than that, but essentially doing a compare by going to each other's countries and learning on site at a co-learning partner.
The main takeaway for me was to see how mature our cases are getting. We did the first event was like, in fact it was 4 years ago, and we had just 3 cases, 1 doctor presenting. And this year we had like 12 cases, and I think 90% of the presenters were doctors. So my key takeaway is that we're getting better in terms of the understanding. Our cases are getting more mature, and people now realize that Lean is not just process improvement. Today, the subject of this event was, in fact, was trying to show our people that there's much more, a lot of other dimensions involved in the transformation.
You know, a lot has happened in the last 13 years, and I'm astonished what I saw today at today's summit. So many physicians, clinicians involved, and you know, just 5 years ago that wasn't happening. So I actually think we've made huge progress. Another handful of years ago it was hard to find anybody in the exec team even coming or participating or going to see, doing any of this. So yes, a lot of progress has been made. But people that know me know I talk about constructive dissatisfaction a lot, and I have that. I think that we have such a long way to go. Flavio and Oriol, my colleagues, have talked about it could take us 1,000 years if we go at the pace we're going, even though we're making good progress. And so I still see huge gaps to close. A lot more to be done.
How we can give the real experience to the people, because we know that about the learning by doing. Okay, so how this doing that other people have done can be transferred to other people, and this can be done, for example, with this summit, but especially with visits. Okay, people visiting other hospitals, trying to understand the real other projects in the real Gemba with the real experience. It doesn't matter if it's at the beginning, at the end, in the middle, but probably not only in the same industry, healthcare in this case. We do a lot of cross-fertilization with other industries, with other people, because what really we're talking about is the transformation itself. And this is the cross-fertilization. Is one of the tools that we're using. And also, what we're doing with these different institutes is also cross-fertilization. We understood that without doing this work of going to the other Gemba, in this case is the country itself, we're not going to really understand the project and the experience.